Hello, everyone. Good evening. I'm Sayukta from Prostate Wellbeing Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic: kidney stones, renal calculi, which are hard, pebble-like pieces of materials that form in one or both of our kidneys when high levels of certain minerals are in our urine. Kidney stones vary in size and shape. They may be as small as a grain of sand or as large as a pea. Rarely, some kidney stones are as big as golf balls. If you have symptoms of kidney stones, including severe pain, bleeding, seek care right away. A doctor, such as a urologist, can treat any pain and prevent further problems, such as a urinary tract infection, UTI. So, to shed more light on the subject and guide us on what's right for diagnosis and treatment of kidney stones, today we have with us renowned urologist Dr. Muqqurab Ali Khan, MBBS, MS General Surgery, DNP Urology. He has a rich experience and hands on expertise in stone management, endourology, lasers, urodynamics, and kidney transplant. He is currently practicing at Care Hospital, Banjara Hills, Hyderabad, Telangana. A very warm welcome to you, Doctor.
Hi, thank you for your warm welcome and good evening.
So, Doctor, today we are going to talk about kidney stones, and kidney stones are quite common, right? We meet people many a times who are having kidney stones, and the only problem is that they don't know why it happens, and many times it's recurring in nature. So, first of all, what are kidney stones? How do they form?
Kidney stones, everyone must be knowing about this thing. Usually, the culprit we say it's a lack of water intake, dehydration. You're working in hot environments, especially the policemen and the hot coal workers, where there are a lot of dehydration. Sometimes it does run in family and obesity or diet, all these things. These are the things concerned with the kidney stones on a major.
Right. And now talking about these symptoms, because symptoms are, one which make them realize that they need to go and consult a doctor and urologist. So what are the symptoms normally like, doctor?
Yeah, kidney stones can be quite symptomatic and asymptomatic. You must be surprised. People will come to a stone a size of nearly 3, 4, 5 centimeters. They must have not had any complaints. Whereas there are stones of 3 mm, 4 mm, 5 mm where they come with excruciating pain. Side.
Yes, doctor. Uh, so doctor, are you there? There's some technical glitch, I guess, some internet connection issue. So can you hear me? So we are talking about kidney stones, which are quite common in people and also about these symptoms. Yes, doctor. Am I audible to you? Okay. We have lost the connectivity. The doctor has lost the connectivity. I'm sure doctor will join back. So today we are talking about kidney stones, and one thing that doctor has just specified is that lack of water intake can lead to kidney stone as one of the major reasons, and thus it becomes very important to have adequate water or adequate fluid. Now. That doesn't mean that we'll increase our caffeine or coffee or tea intake or alcohol intake. What we need is water or juices, etc., which are equally healthy and not work as irritant to our bladder. So this is the one thing which is very important to note down, that adequate water or adequate liquid intake is very important. Kidney stones are very common, and one problem that many a times we encounters recurrence. So, doctor, welcome back. And there was some internet issue, I'm sure,
Yeah.
but good that you're back. So we were talking about symptoms. That's where we, lost the connection. So if you can just repeat, what are the major symptoms to look for?
Major symptoms being the pain. Pain is the most common. There is it has excruciating pain on the flank sides, on the either side of your abdomen. Nausea, vomiting, fever, and with chills and rigor. Some patients do present, and sometimes the stones, as I was telling, there are large stones which don't cause any kind of symptoms only. They just grow and destroy the kidneys.
Oh, right. So for that, during checkups or annual medical
The regular
checkups,
health
one gets.
they do have been picked up.
Mhm. Okay. Now, what causes these kidney stones, doctor? One, you said that, it's not having enough water, adequate water or liquid intake. What are the other things? I mean, because many times we get to hear that those who, have more non-veg diet can tend to have more kidney stones. So, does any do
Yeah, this the
things
thing. The
matter?
reason of kidney stone formation is, as I've already told, water intake, dehydration, the protein intake, high amount of calcium, obesity. Sometimes it does run in family, and the locality where do you come from, that also matters a lot. So some genetic reasons also are there, which are less frequent, but most of the stones are calcium stones, which are nearly 80 to 90%, and these are the main reasons for having the stones.
Now, most of the time, when people get to know, because it's only after the diagnosis that people get to know that they have kidney stone at such as the size. Rather than going for further treatment, they'll rather go for, home remedies or going by what the influencers or various social media platforms are saying, or
Yeah.
alternate therapies. Do they work?
Fortunately, they do work for a considerable size of the stones. If the stone size is less than 5 mm, then there are very high chance that it falls spontaneously.
Okay.
But that adequate hydration is the key for that. And sometimes even in 3 mm, 4 mm stone gets stuck up and it doesn't come out only. Then it causes a lot of problem. So home remedies, especially water, high amount of water intake that's supposed to take. Some people take some amount of beer and all, but still there's the same diuretic kind of phenomena where water content is essential to push out the stone or flush out the stone. If it is of a lesser size, you should not try for a large stone with water intake.
Right. So water therapy is the best therapy in that
Yeah.
way. Now, when a patient comes to you with these symptoms, how do you get it diagnosed? What are the tests that normally you suggest?
First, I would examine the patient. Hello. Uh, First, I would examine the patient, look for any signs and symptoms of any toxic nature, like is the patient stable or not. Then I'll go and look at is this flank tenderness, any pain is there, which I would like to test. If I find any tenderness and all the picture is fitting to me in the sign of it is in kidney stone or bladder stone or ureter stone, I would ask for an ultrasound, X-ray, and routine blood investigations. An ultrasound and X-ray are my initial screening tools to help me diagnose them.
Right. And doctor, what are the treatment options available? Because with kidney stone, another fear is that they'll have to go under knife or have to get it operated. So, what are the latest techniques, etc.? And apart from the surgical process, what are the ways to get it out?
Yes, coming to the management of the kidney stones, as you asked, one is the medical expulsion therapy, where the kidney stone size of less than 3, 4, 5 mm, we can use with water and an alpha blocker that helps to expel the stone. If it is not coming out and it's creating a lot of issues like fever, nausea, vomiting, and excruciating pain, then we might advise the patient to go for surgery. Based on the location of the stone, the treatment is there. If it is in kidney, ureter, bladder, there's a different mode of modality of treatment. So basically, if it's a bladder stone, we ask for an vesicle PCCL or go per urethral and break the stone. If it is in the ureter, the ureter is a tube connecting the kidney and the bladder. So it is a very narrow tube, which is the main culprit of holding this, which is the main culprit to hold the stones. So if it is there, then you would put a stent or you will directly go and break. That is that surgery is called URSL. And if it is in the kidney, there are again two types of surgeries which we offer. If it's a very large stone, more than 2.5 centimeter stone, then we have to go into the kidney from our flanks into the through a needle and break it. So that is called PCNL. And the latest advance what we are doing is up to 2 centimeter, 2.5. When the patient requests, sir, we can't take and puncture in our kidney, please help us through any no cut, no hole, no scar method. The latest one is RIRS, that is retrograde intrarenal surgery, where we go from without cutting anything, we just go through the natural passage and with a flexible scope inside all the way up to the kidney. Then we lase it, we fragment the stone with a laser machine where it becomes a powder, like a talcum powder kind of thing. That fine material made, and we put a stent, and mostly the patient is sent next day home.
Right. One of our viewer, Abhishek Sen, is here asking what complications can arise from untreated kidney stones, doctor?
Okay, if the stones are not treated, then it is a source of infection. And sometimes if it passes off, then not an issue. Again, of the size is important, Mr. Sen. If it is a large stone, if it gets stuck over the place and not moving at all, then the urine above that column which is supposed to flow down, it gets blocked there, and then it becomes like a source of infection. It's as if like your dishwasher is there, the daily the water flows, the dishwash is clean. Once the dishwasher is blocked, then the above thing, the whatever clean urine or what water you put in the dish, it will get just infected. The same way it will get infected, and sepsis, that means you will have fever, chills, rigors, and the kidney damage starts to occur to a certain extent that we have to go into the hospital and manage it in an emergency basis. Sometimes even destroying the kidney has to that far it can lead to.
Right. So the bottom line stays that in case you have these symptoms, please go consult your doctor and trust your doctor. Please complete the whole treatment. That's really important. One more question, doctor. What can be done to help prevent a recurrence of kidney stone?
Yes, there are recurrent stone formers. There is a chance of nearly for over 10 years, there is 50% to 40% chance the stone might occur again. So once a stone forms, once the patient has stones, we have to go for a metabolic workup. So a few of the blood and urine tests will be taken, where they'll do a particular panel of tests and find out what is the parameter that is abnormal in him. For example, high levels of calcium, low citrate, high level of sodium, all those things they'll be calculating. And once we break the stone and have small fragment particle taken out, we'll send it for analysis. And that will give us a picture what kind of stone it is, and does it require, is it high chance that he might have a recurrence again.
Right. One more question from our viewer, Sarthak Rajput. Can certain food or food items or drinks increase the risk of developing kidney stones? And many times we are asked to avoid certain, food items. So is it a umbrella list that we need to avoid?
Yeah, there are a lot of patients that do keep up asking, sir, what food should I avoid? What should see? Basically, you can't avoid many of the foods, but there is one panel. If you go and search in online, also there will. It's a very common thing. They would have given you the instructions and all those which you have to take and not to take. But anything in moderate consumption with high amount of fluid intake, it balance. For example, if I tell you don't take tomatoes and all, how many curries can you make without tomatoes? So hardly anything.
Correct.
So anything with moderate consumption with high water intake. Okay, once we realize what is your basically the protein diet, I would recommend to go down, especially that mutton, chicken. We should restrict that.
Okay. And doctor, before we sum up the whole session, any take-home message for our viewers?
Yeah, kidney stones. If you have any complaint of pain, abdomen, nausea, vomiting, radiating from front to back to front, and these are the main complaints. If you do have, mostly during the summer time, check out with your urologist who is in a specialist in this expertise in this particular field. And at Care Hospital, Banjara Hills, we do provide services, and feel free to contact us. Not all should be operated. Remember this, there are patients who are managed conservatively with some medicine, they will be expelled out. At the same time, don't shy away from treatment. Okay, just come, we will tell you if at all there is a need of treatment. We'll help you to sort out which category you do fall in. If it is required, then only we'll suggest for a surgical, or else with medical treatment, patient of less smaller size will be beneficial. I have treated patient with even 11 mm, 12 mm stones just at the tip with proper 1 week. If they are responding, they come quite happily saying, sir, we didn't have for surgery. Thank you. And don't shy away from being a doctor. Trust him.
Right, right. Going to a doctor, the right person, and trusting your doctors, really. And thank you so much, doctor, for your valuable time. And it has been quite an informative session for our viewers as well. Thank you very much.
Thank you for your time.
And thank you, viewers, for your excellent participation. For more information and updates, stay connected on our FB page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day ahead. Goodbye.
Bye.